Breast cancer is the most common cancer in women. An estimated 1 in 8 women will develop invasive breast cancer in their lifetime, and 1 in 35 will die from it.
About 207,099 cases of breast cancer will occur in women in 2010.
Breast cancer is the second leading cause of cancer death in women, exceeded only by lung cancer.
Approximately 39,840 women will die from breast cancer in 2010.
The chance of developing invasive breast cancer at some one point during a woman's life is about 1 in 8.
5 to 10% of breast cancers are thought to be hereditary.
About 2/3 of invasive breast cancers are found in women that are age 55 or older.
There are currently more than 2.5 million breast cancer survivors in the U.S.
Cancer occurs when cells in your body start to grow abnormally fast. As the cancer cells multiply, they often form a mass of tissue or a tumor. Breast cancer occurs when these tumors form in the breast tissue. Tumors in the breast grow slowly, and it can take up to 10 years before a lump can be felt. This is why early detection is so important.
We do not know what causes breast cancer. We do know that there are certain gene mutations that can increase your risk for developing breast cancer. We also know that there are several factors that seem to increase your risk for getting breast cancer. However, many women who develop breast cancer have very few of the non-risk factors, and some women who have several risk factors never develop breast cancer. Because of this, it is very important that all women get the recommended screening test before any symptoms develop. There are many risk factors for developing breast cancer. Some of these factors cannot be changed, but others are related to your lifestyle. Some of the risk factors that you cannot change include gender, aging, and family history. Some of the lifestyle-related factors include alcohol consumption, being overweight, or lack of exercise.
Simply being a woman is the main risk factor for getting breast cancer. Men can develop breast cancer, but it's about 100 times more likely in women.
If you have a mother, sister, or daughter that has had breast cancer, your risk of developing doubles. If you have 2 close family members with breast cancer, your risk increases by 5. 20 to 30% of women with breast cancer have a family member that has had this disease.
Women who start menstruating before age 12 or who go through menopause after 55 years of age have a higher risk of developing breast cancer. There's also increasing evidence that lack of exercise increases your risk of breast cancer.
Patients that received radiation to the chest for other conditions are at an increased risk of breast cancer.
Women without children, or those women who are over the age of 30 when they have their first baby, are more likely to develop breast cancer. Breastfeeding for 1.5 to 2 years may decrease your risk of getting breast cancer.
Overweight women have a higher risk for developing breast cancer, especially if they're postmenopause. Since we don't know exactly what causes breast cancer, we can't prevent it. However, there are ways to lower your risk and ways to increase the likelihood that it will be found earlier if it does occur. You can lower your risk by breastfeeding, by limiting your alcohol intake, by exercising regularly, and by maintaining a healthy body weight. Other than lifestyle changes, the most important thing that you can do is follow early detection guidelines.
Women aged 40 and older should have a screening mammogram every year and should continue to do so for as long as they are in good health. Women in their 20s and 30s should have a breast exam by a health professional, such as your gynecologist, at least every 3 years. After age 40, women should have a breast exam by a health professional every year. Breast self-exam is an option for women starting in their 20s. Women should report any changes in their breast to a health professional immediately. Women at high risk should get a MRI and a mammogram every year.
The stage or extent of the cancer in the body is generally used to guide the initial choice of treatment. The stage is based on several factors, whether the cancer is invasive or non-invasive, the size of the tumor, the number of lymph nodes involved, whether it has spread to other parts of the body. Invasive cancer stages range from stage 1, which is the least advanced, to stage 4, the most advanced. Stage 0 indicates non-invasive breast cancer, sometimes called in situ carcinoma or intraductal carcinoma.
If you have been diagnosed with breast cancer, there are several questions you may want to consider asking your doctor. For example, what type of breast cancer do I have?
Has my cancer spread?
What stage is my cancer in and what is the prognosis?
Are there tests that should be done before we decide on a treatment?
What treatments are appropriate for me?
What are the side effects of these treatments?
What are the risks involved with these treatments? And what type of follow-up will I need after treatment?
Your health is in your hands. The doctors and staff in the radiology department at NAB Medical Center are here to help. Breast self-examination every month, regular consultations with your physician, and yearly mammograms is the best way available for the early detection of breast cancer, which would save your life. While there is no perfect method to detect breast cancer, the combination of your dedication with a prompt evaluation by the breast care team at NAB Medical Center will give you the best chances to detect breast cancer in its earliest stages. We care. We have state-of-the-art equipment, highly trained technical personnel, as well as board-certified radiologists, and we offer our experience, advice, and support to you. Call us. Come visit. Together, we can make a difference. Together, we can make an impact and decrease the crippling effects of breast cancer and diminish the mortality of this dreadful disease.